Hello, everybody. This is Dr. Allison Beitel, pediatrician. It is Sunday, March 22nd. We're in the middle of the coronavirus pandemic, and I thought at this juncture it would be very useful to discuss a topic that we are not hearing much about in the news, and that is the management of fever in the setting of coronavirus or other infectious illnesses. Why is it so important to discuss fever? Well, fever is a critical evolutionary response that has developed to help our bodies fight infection. Fever is something that we see across many species, including reptiles. In the setting of an elevated temperature, our immune mediators are all more active and more effective. So our B cells, our T cells, our inflammatory modulators do a better job at fighting viruses and bacteria when we have a fever. Now, in general, we have quite a bit more data on the relationship between fever and the immune system from animal studies than from human studies. And this makes sense because researchers aren't going to spend a lot of time infecting purposefully human subjects with viruses and bacteria. So again, we do have more numbers from animal studies, but a lot of this data we can extrapolate. And we know from animal studies that fever is very beneficial. For example, studies have shown that in animals, when they have a fever and they're fighting off a virus, if we purposefully lower their temperatures, then that animal is going to be more infectious. They are going to shed more virus. They are going to shed virus for a longer period of time. So they lose out on some of the protective effects of fever from an immune standpoint. Now, on an individual level for humans in particular, the cost of treating fever might not be very high. But when you think about a whole population of people trying to fight an infection at the same time, especially one that may be very contagious or have a high morbidity or mortality rate, then the cost of treating fever becomes a little bit more significant. Now, another issue that we can all, I think, personally relate to in this country is that we as Americans are very, very hardworking. We don't want to miss out on work. And so often the first moment that we feel a little bit sick, we're going to take antipyretics like Tylenol and Motrin to make ourselves feel better. And then what happens? Well, we feel better and we go back to work, often prematurely when we're still infectious. We share germs with colleagues, and it's not an ideal situation. So on a similar level, things like this happen in our homes. When children are sick, parents, of course, want to make them feel better. They want to do something. So they treat their kids with Tylenol and Motrin, and suddenly children who were very, very ill are up and about, running around. And that just goes to show that when we make them feel better fast, it can lead to a situation in which the children will overexert themselves when they ought to be resting. And we can see how this could lead to a child being sicker for a longer period of time. This is exactly what animal studies show us, that in some cases, when we treat fever, the animals are sicker for more days and the symptoms can be more severe. So indeed, we are starting to see this kind of data actually coming out of the coronavirus pandemic. So this past week from Europe, but particularly France, we started to get the message that ibuprofen, which is an anti-inflammatory, is the same thing as Motrin and ibuprofen, potentially can make people more sick, more severe symptoms in the setting of coronavirus. Now, these are just anecdotal reports. We need to take them definitely with a grain of salt. There may be hard data on this eventually, but for the moment, doctors are urging caution that if somebody has corona, that it may be best to stay away from ibuprofen, Motrin, Advil, the anti-inflammatories. Now, I would add that with these recommendations, there wasn't much discussion of fever. And of course, fever, aside from all those immune modulators, fever in and of itself is a great defense mechanism. So if I have a situation where somebody is sick with an infection, but it's an uncomplicated situation, there's no breathing problems, I'm generally going to advise that we not treat with anything, neither Motrin nor Tylenol. Fever can do its job and help the individual get better faster, especially if we just leave it alone. Now, let's take a moment to differentiate between a physiologic fever from infection versus a non-physiologic fever. Non-physiologic fevers are what you might see in people like football players who are wearing heavy equipment on a hot day, not drinking well. In that situation, the temperature can rise in an uncontrolled fashion, leading to problems like heat stroke. This is not the case with physiologic fever, in which the hypothalamus is purposefully elevating the temperature. So parents always worry, as the temperature is going up in children, 101, 102, 103, oh my God, what's going to happen at 104, 105? They worry about brain damage. But this is not the case. Brain damage does not ensue. This is physiologic fever. It is protective. On a related point, I should say here that I frequently will tell parents it's not the height of the fever that matters. What matters is the associated symptoms. For example, you could have someone with a relatively low fever, 101, 102. If that person has a stiff neck, I'm going to be worried about meningitis. Conversely, if you have a kid who's 105 and they're running around the room like a little crazy person, then you know that they're probably okay. Anecdotally speaking, in my own practice, what I've tended to observe is that when kids have viral illnesses, if they are mounting very high fevers, usually those fevers don't last too long. The kids tend to get better more quickly. And then in terms of high fevers, what we saw this past week, this data that we now have coming out of China, we looked at some of the sickest people with coronavirus infection. And what that data showed was that if you were unfortunate enough to develop ARDS, acute respiratory distress syndrome, and end up on a ventilator, that if you were able to mount a high fever, 39 degrees Celsius or higher, in that case, your mortality rate went down. It was lower than if you weren't able to mount a high fever. So this is an example, perhaps, where we can think about the fact that fever is protective and is an excellent defense mechanism. Now, just a quick word here. There are some cases where antipyretic medications are going to be very useful. If you have a child or adult who is not drinking, so that person's getting dehydrated, if they have a really bad sore throat, they can't swallow, if they're in pain, then these meds are going to be definitely clinically useful. Similarly, if you have somebody who's not sleeping, that's a problem. Sleep is very important for rebooting the immune system. So if you have a child who can't sleep because of a fever or pain, of course, I would recommend treating them with Motrin or Tylenol. In an ICU setting, people who are brain damaged sometimes benefit from being treated with antipyretics. And also people in septic shock sometimes will benefit from the fever being treated. Now, that brings up the point that there is metabolic cost to fever. So when someone has a fever, their heart rate goes up, their rate of breathing goes up, and there may be a tipping point at which bringing down the fever can be useful. But in general, if we're dealing with a situation where somebody has a virus or a bacterial illness, they're mounting a fever to fight that infection, in that clinical scenario, if there's no other issues, if it's uncomplicated, then probably the best course of action is not to treat with either Tylenol or Motrin. We should let Mother Nature do her job and help the body fight the infection with the fever. Now, this is in contrast to what a lot of families do now. Again, parents worry about their kids. They don't want the children to suffer. They want to feel like they're doing something, which of course is understandable. And I think people this past week have been panicking a lot with having difficulty finding Motrin and Tylenol on the shelves for their kids. The ironic thing here is that in the absence of these medications, we all, in the population might do a little bit better as a whole if we're not treating fever. Or at least not treating fever quite as aggressively. And on a last related point, I just want to add something about febrile seizures. People really worry about kids with a history of febrile seizures. There's a tendency amongst parents and pediatricians to talk about aggressively treating, alternating Tylenol, Motrin, but the medical evidence overwhelmingly says don't bother, because treating kids in this fashion who have a history of febrile seizures with antipyretics will not decrease the risk of febrile seizure recurrence. So again, the evidence clearly shows that there's no need to aggressively treat fever in kids who have a history of febrile seizures. And of course, this is a frightening condition, but in the end, it is a benign condition. So this is a pretty fascinating topic. I hope you enjoyed learning about fever in the setting of coronavirus and infectious illnesses. If you'd like to learn more about this topic or see more of my blog, you can look at my website, which is www.abcparenting.blog. That's www.abcparenting.blog. So, for the next few weeks, I want to wish everybody good luck. Please get a lot of sleep, eat a lot of healthy food, avoid antipyretics if you don't really need them, and let's do some good social distancing to help bring this epidemic to an end. See you later.